Very proud to be part of the medical staff at Gaylord. We have a skilled team of professionals that work hard to stay current in their education and to do the best to take care of our patients.
Our admissions process begins at the acute care hospital. The healthcare regional managers determine eligibility for patients requiring LTAC placement.
Our patients come to us very sick, and many times all different types of disease processes, whether it be end-stage lung disease, heart failure, arrhythmias. Many of our patients have been to the operating room and come to us with open wounds that still have to be cared for.
When the patient first comes in on admission, they're provided with a physical therapist, an occupational therapist, speech therapist, and a TR, all depending on their needs. That therapist would start with doing an assessment of the patient. That assessment will focus on function, their overall mobility, and their ability to complete self-care activities. We start by educating the patient and their family on the plan of care, and we try to get their input on what they want the long-term goals to be.
We have a lot of different advances that we've taken advantage of to take care of our patients, including cardiac monitoring and telemetry that allows our patients to get out of bed early and start their therapy outside their room.
We also offer radiology services. We have CAT scan available, X-ray and speech studies available.
If they're able to leave the room, we can start working in a satellite gym. We can provide customized care on the unit, so we can really push the patient, but at the same point, look out for their medical needs.
We maintain a state of readiness in taking care of them. That involves not only our providers, but our physical resources. One of the best of those is our Milne unit that is essentially very similar to a step-down unit that they might be going if they were going to stay in a hospital for a prolonged period.
We hope then we can move down to what we're in now, which is our inpatient therapy gym. We have a 3,000 square foot beautiful area that has an OT ADL suite as well as this portion of the gym here. Patients receive both individual sessions as well as group sessions. We have many different new and exciting pieces of equipment that can help a patient, improve back to their normal level of functioning. Some of those are Myomo, Bioness, Exo, high-low mats. We have overhead lift systems. We have a assistive technology suite where we have different kinds of systems that can help. We have iPads. We have Drag and Dictate, which you can communicate verbally and help control the computer. We also have Wii, which is more of a gaming system that we can use for balance and any kind of cognitive task. Easy Street is one area that we're pretty proud of here at Gaylord. It's an area we use to work on balance and everyday activities. We also have a beautiful TR area upstairs, and they have basketball hoops, pool tables, and many other activities that we can make the patient feel a little bit more comfortable. We have a greenhouse where we can help patients if they love gardening or doing something of that activity. That'll help us make them feel a little bit more at home.
As a care manager, we are responsible for weekly reviews that we submit to insurances, and that review is compiled through our team meetings. The team meeting is composed of a care manager, the physician, nurses, a physical therapist, social services. We meet once a week and discuss patients' status, any issues, any concerns. That information is then relayed to the patient during walking rounds. At that time, the patient can ask any questions right at the bedside.
You have to have great people to have a good healthcare organization, and I think that's what Gaylord has built its reputation on.
We have staff that have many different levels of expertise. We have neuroclinical specialists. We have an aquatic therapist. We also have somebody specializing in lymphedema.
Our medically complex patients have respiratory therapist access on every unit here at the hospital.
And our hospitals are here 24/7.
The therapists here have great compassion and drive to help patients persevere so they can reach their goals while at Gaylord and become more independent to finally reach home.
Discharge planning at Gaylord begins at admission, and the goal of the team is to discharge a patient to his or her highest level of function at the next level of care.
We will set up training with the home care company and coordinate the discharge.
We do a lot of family training with patients. We work on car transfers and every different kinds of mobility, including going up and down stairs, bathroom transfers, anything that the family is going to need to do at home with the patient.
With an acute care illness, patients oftentimes don't have a choice. After that, and they find a need that they have to go to a post-acute care hospital, they do have a choice. We recommend they go to gaylord.org to look at our site and to review our outcomes. We recommend that family members that can come to Gaylord Hospital and take a tour and meet the people and review what we have available. People who will go online to look at how Gaylord did will see that we stand out as one of the best hospitals in the Northeast.